Center has 84, and Hospital Center Connecticut has 38 patients, and Wyndham Hospital has 1 patient. A behavioral health network has 2, and community network has 166 patients at this time. These are our numbers. As you see, the numbers are declining of our total number of patients in all our facilities right now, which is a positive and good sign. State of Connecticut has seen a decline over several days, almost about 11 days of acute hospitalization. As indicated last week, we're going to continue to see the rise in total number of active cases in across the Connecticut because we're testing more. But the positive sign is that the hospitalization numbers are going down, which tells us a couple of things. One, the hospitals are definitely not overwhelmed. They're managing capacity very well, which is a good sign. Number two, we are seeing the severity of those patients coming to the hospital declining to a certain extent as well. That's a positive sign as well. However, we continue to have a mortality added to our number of patients across the state of Connecticut. We are close to 2,500 at this time. And obviously, there is a significant spread still out there in the SNF and the assisted living and group home facility, which is a concern at the moment. My hope is that we're going to continue to see a decline, the gradual decline which is happening, and it's not a precipitous decline. It's a gradual decline of the number of patients we're seeing. It's a good sign at this time. Now, what does it mean for our peak and capacity in the future, which is, it depends on multiple factors. We continue to obviously see the decline in number of active patients, which is a good thing. Number two, the contact tracing is going to be huge for us to be able to return to some sort of a normal environment over the time. Our still concern remains regarding the testing. We need to ramp up the testing as much as we can. The more testing we can do, the more patients we can isolate, we can quarantine, and we can hopefully get back to normal at some point. The challenge we have as we think about this virus, which is so new and still no specific cure in our hands right now, and the immunity and the vaccine is still far away, we are going to continue to worry about the resurgence or the pockets coming over the time. And that's one of the reasons our social distancing measures about contact tracing and antibody testing, the PCR testing needs to be continued in the forefront. The positive in all of that, if there is one, is the hospitals are not overwhelmed. They're ready for taking care of the patients. And as we have put together a lot of safety precautions, such as the different triage mechanism, safety precautions, and other things, Hartford Healthcare is in a good place right now to be able to care for non-COVID and COVID patients simultaneously. So that's where we are right now as a hospital's perspective. A wonderful week. Nurses Week is going to begin on Wednesday. As you know, the nurses have really stood up the challenge at this time and really demonstrated the real healthcare heroes among us. So there's much to celebrate, much to recognize, and much to talk about this over the next week. So you'll hear a lot more information coming from Hartford Healthcare side. We had talked about mobile testing. We're rolling it out as we speak. Newington, Mystic, and Westport. They're all open on Friday. We're going to add more locations as best we can. We want to make sure the testing is available for the most vulnerable population, the populations such as SNF and nursing homes and assisted livings and or other areas, shelter homes and things like that. Hartford Healthcare right now is in the process of testing all SNF-based patients across the Hartford Hospital, Hartford Healthcare SNF, which we manage 3 of them, and we have assisted living as well. So we're going to test all the residents to make sure we prepare ourselves and we make sure we take care of them as well as we can. The conversation is about essential surgeries or resumption of normal operations in the hospital. So let me begin with a comment that we actually never stopped taking care of the urgent and emergent surgeries or procedures. We were always there for our community, and we're going to continue to make that process more widely available for essential surgeries. And the way we define the essential surgery is that if somebody requires a procedure because they're hurting for pain or they've got some other issues going on, without creating a significant risk to the patients, some of those surgeries were delayed. Now we want to bring those procedures and surgeries back, which are required for our daily living activities of our individuals' needs at this time. Some of the surgeries which can be postponed for some more time without risking the patients, we will triage them appropriately. We want to make sure we have a very safe resumption of a process. We want to make sure our supplies are good. We want to make sure the staff is there. We want to make sure that all other space is available for COVID and non-COVID. But most importantly, we are safe. I think that is something we need to continue to focus on then. So our commitment to the community is a very safe environment when we begin our operation or resume our operation, which was put on hold for a while. With that, I think I'm going to stop here for any questions at this time. Thank you.
Hi, Dr. Kumar. This is Emily from The Current. I was seeing over the weekend that some states, particularly the states that have reopened their businesses, but also just any states that had good weather over this weekend, that they were seeing a drop in social distancing measures. Do you have concerns about that happening in Connecticut? And can you talk a bit about what would happen if we did relax social distancing?
Yeah, I do have concerns about that. Let me go back to some of the states actually who are changing or a bit more aggressive in the social distancing and other things as well. I think one of the unfortunate times we've had right now is not being able to understand what is the prevalence rate any part. Some of the states where the active cases report is lower is because we don't know. We're not testing enough. So unless we report the test very well, we don't know actually the active cases, and that's the constant challenge we've had from the beginning of this pandemic. I do worry about it. The social distancing measure is only one thing we have at this time, which really reduces the spread of the disease. And you have to think in certain ways. We are really looking after our own community here. If we relax the social distancing, the virus travels. It's still as lethal as it was in Feb or March or April. Our most vulnerable populations, such as elderly, the individuals with chronic medical disease, are the ones who are going to get the brunt of it. So my plea to the public is that we are impatient. We need to get back to the normal working, a normal place here, but we still need to make sure we wear the mask in the right place. We actually following the social distancing, and these things are going to be critical for us to reduce the amount of suffering we're going to have in the community. And the more we can pass this out over the time and better therapies and immunity becomes available, I think we'll be in a much better place at that time.
Thank you.
You're welcome.
Hi, Doctor. It's Bridget from the Republican American.
Hi, Bridget.
I know that you have mentioned several times the nursing facilities and assisted livings as a concern. And it's interesting that if you look at the statistics, there are some facilities that have just an overwhelming number of patients and lethality. And then there are some that actually have no COVID in their facility at all. Is there a difference that we know about that is remarkable for those that have the high incidence versus those that don't?
You know, I wouldn't be able to comment on all the nursing homes, or at least segregate them two different ways, but I can talk about general principles. Some of those times, you know, the practices about infection prevention, how ready we were in different nursing homes, the precautions we put together in terms of visitor restrictions and all that thing have contributed to somehow limiting the spread in some of the nursing homes. One of the big challenges the nursing homes or assisted living or any of the members have is the containment is rather challenging. This is a place where a lot of vulnerable populations is in one area. And then we have staff actually who's working in multiple different facilities, and they're doing more shifts than one, and they're working in one facility today and then other facility in the other day. And still, the spread which could happen because some visitations and some of the mortality we are seeing and the other folks visiting in some isolated incidents, it creates an exposure risk for us. So nursing home, assisted living, and group homes will always remain challenging for all of us to manage. And quite frankly, I think we've seen the most mortality across the nation in those facilities at this time. I think we need just to continue to pay attention to that. And I like to say that our governor's team and the public health officials paying a lot of attention to that. So I'm hoping we're going to reduce as much as possible the mortality in those areas as we go forward. But so far, that has been our biggest concern.
Thank you.
You're welcome.
And Dr. Kumar, this is Emily from The Current again. Following up on Bridget's question, do you have an idea of the timeline for testing the residents of Hartford Healthcare's assisted living facilities?
We rolled it out last week, and we're doing it in phases. I would imagine by mid this week, we would test everybody who's in Hartford Healthcare SNF facility will be tested, and soon after that, assisted living.
Dr. Kumar, this is Aisha from Fox 61. Just wanted to get some comments from you on the announcement from yesterday with the governors announcing a regional agreement for PPE supply. I guess, how is Hartford Healthcare, if you guys are getting ready for if there is a second wave later on this year as far as personal protective equipment? How is the PPE supply doing right now? If you don't mind just commenting on that.
Sure. You know, our PPE supply in Hartford Healthcare is adequate. We feel confident for next several weeks to go by. As from the beginning, when I started doing this media briefing, I've been saying that we've been following a disciplined and thoughtful approach, working with the supply chain very aggressively to make sure our colleagues are protected across the Hartford Healthcare. And we've done a good job. It's May right now, and I can anticipate we'll another month or two we'll be fine as we see ourselves today. Supply does remain a challenge. We have to keep a constant eye on that, and there's a bit of an erratic nature of how the shipments are coming in or not coming in as well. But our teams are working very hard to make sure we continue to pay attention to that. This is going to be a significant challenge for us. If you think about what the second wave or the fall or the next early winter is going to look like for us, we need to do a few things in our toolbox as we go forward. We need to make sure the adequate supply of PPE continues for almost about a year with a heightened number, increased number because of the COVID for all the healthcare systems across the state. We do need to make sure the contact tracing within the hospital systems is optimized, and there's almost a SWAT team approach we're taking right now. If you find an incident of a outbreak or a infection happening, I want to make sure infection prevention, our safety individuals are paying very close attention to them, containing it as fast as we can, understanding who might have got exposed, isolate them as quickly as possible. So we need to be very aggressive in our contact tracing and responding to that part here. Number three is that we do need to make sure that we continue to maintain our facilities as safe as possible with disinfectant and all the things. We continue to do that. We want to be ready for the second wave, and we continue to analyze our capacity and make sure we have capability of scaling up or scaling down depending on the need of the community. Now, working with MIT and other members, we've been doing it that we've already got a lot of modeling already done. We're well prepared for that. As indicated, we were, and some have called we might have been over-prepared, which I feel is a good place to be. And Hartford Healthcare has been very well prepared in making sure the capacity is extended. So if the second wave comes in, let's just say hypothetically, and I say hypothetically, sometime in the fall, we are confident today that we will be ready with the space, supply, manpower, and PPE. We're going to continue to keep an eye on that at this time. So our healthcare system will be ready for that if it comes. I hope it doesn't. I hope the social distancing measures prevail. I hope the therapeutics prevail. But at the same time, there's a real risk for that.
Dr. Kumar, this is Matt Pilon from the Hartford Business Journal. Just a quick question about PPE. Obviously, the focus has understandably been on hospitals and healthcare facilities for making sure they have enough of that. As the state looks to sort of, reopen in increments, what about, just regular consumers, everyday people, as well as businesses in terms of access to masks of sort of adequate quality. I mean, people have been wearing, bandanas and stuff around their face, but, is it important to sort of have a certain level of mask or protection for the general public? I'll just quickly note, there's an East Hartford company that just the other day started selling a big stockpile of KN95 masks to the general public, which is the first I'd seen of that anyway, anecdotally. But what do we sort of make of everyday people and wearing masks going forward? Is there an adequate supply out there? Does it matter if it's a bandana versus, a more fancy mask with a filter in it?
It's a great question. So there's a lot in this question, so I'm going to try to break it down as best I can. So I think for the large employers at this time, I would advise them to start thinking in multiple different ways, and they probably would need some healthcare needs, and Hartford Healthcare is already supporting and ready to support in many different ways. We need to make sure that our large employers start thinking in terms of they have an adequate supply of the disinfectant PPE, which is the mask or other thing, and I'll go back to the mask in a second. They understand the infection prevention education. They understand how do you actually do the contact tracing, or at least isolate if that things get out of control. At the same time, they need to have excellent access to the clinicians in a quick and a fashion as well. Now, Hartford Healthcare, as you know, rolled out this virtual health platform. We've done more than 64,000 visitations only from March, so you can imagine how we expanded. So we are happy to support the businesses at this time who require that kind of expertise in a kind of a comprehensive strategy to be able to support them as needed. And I encourage anybody to reach out to us, and we're happy to help at this time. Now, in terms of the mask, for the general public who's out in open, wearing a mask of any kind is better than not wearing anything. Obviously, a surgical mask is a much better one to protect, but a bandana or a cloth mask is a reasonable thing to do at this time because it does actually reduce the risk of transmission to a certain extent. However, it needs to be washed carefully. It needs to be managed carefully, and it needs to be managed in a way that it doesn't lead a place for growing viral culture and it spreads even further. In terms of types of masks, there's a lot of confusion, and I must advise to the community and the public, there's a lot of fraudulent product out there as well in the community. And so people need to be watching out and making sure that they buy for the right purpose. Interesting thing you mentioned about the KN95 and N95. There are two different masks. I just want to kind of explain a little bit here. N95 is a CDC-supported mask, which actually provides a complete cover for any inhalation of virus through our nose or mouth. It actually is fit tested in the hospital setting to the appropriate setting. When we check, make sure there is no air leak happening. KN95 is not approved by OSHA at this time for that kind of level of expertise. Now, general public do not need that kind of protection. You do not need complete protection because that protection is required for physicians or the nurses who are working in an environment where we are treating a patient where there is a possibility of aerosolized virus in the air. So going for KN95 or N95 is not required for public unless you're working in an environment when there is a significant risk for exposure, which is generally in the healthcare facilities. So that is not required. A surgical mask or cloth mask is reasonable to use that. But if you do have means to spend and to be able to buy KN95, it's not going to hurt you. It's going to be fine, even N95. N95 is in short supply, as you know. This is one of the critical experience we've had in the beginning. And thanks to the state's effort, we are able to reprocess some of those masks here. So just the individuals need to be aware. I advise everybody to look at the OSHA website and CDC website. There's a lot of information out there which actually can educate our community at this time on those masks.
Thank you.
You're welcome.
Dr. Kumar, it's Bridget again as a Republican. Regarding social distancing, we talk about the fall and the concerns about the fall resurgence, and yet there seems to be this loosening for the summer. Some people have this mood of sort of having the summer off, And there are some venues that have not canceled events throughout New England and the United States. And I'm thinking for instance, of Tanglewood in Massachusetts, where there's very close quarters and many, many people gathering. Is it wise to let some of those go forward or to stop them?
It's not wise to be in a close quarter at this time. I think folks need to take adequate precautions as well. But at the same time, I like to qualify my statement with that. If the events can happen with appropriate social distancing in the with the right precautions, it may be okay for the limited number of individuals to attend at some point. I'm not saying the point is today at the moment. We still have to see a continuous decline in our active cases or hospitalization. We still have to make sure the contact tracing and other measures are in place. We still have to make sure that the testing is appropriate. So we're not quite there in early May. Would we be in July or August? We could very well be, but at the same time, I would not recommend the social distancing to be loosened till we have the right therapeutics, immunity, or vaccines available. And that's still a little far away. So I think it needs to be assessed week by week basis. I'm not actually aware of what Tanglewood is doing at this time. I would imagine the Massachusetts state is doing a lot of work in contact tracing, and they've done some innovative ideas on that part here. So I would imagine they have reasons to think differently about this. I can't comment on that specifically. I haven't read much about this.
Thank you.
You're welcome. Well, if there's no further question, Tina, is there anything else from the Facebook? We're all good? Well, thank you very much. I hope all of you remember our nurses this week. This is a Wednesday, the Nurses Week. And as you write your publications and you talk about it, I hope you recognize our true heroes of the healthcare system. Thank you.